Our next bill is House File 1268. This is Representative Richardson's bill. I would like to move that this bill be laid over for possible inclusion in our finance bill. Representative Richardson, are you with us?
Yes, I'm here, Chair.
Nice to see you. Representative Richardson, will you please present your bill?
Thank you, Chair Hewitt. House File 1268 is focused on supporting healthy prenatal development and healthy development of infants. In Minnesota, we know that we continue to have persistent and unacceptable health disparities in infant mortality and morbidity. We have heard the heartbreaking statistics that in this state, Black and Indigenous infants are more than twice as likely to die than white infants before their first birthday. Despite the long-standing racial disparities in infant mortality and morbidity, public attention has only been recently focused on this issue as a public health crisis. This bill would provide a one-time appropriation to the African American Babies Coalition to implement a community-based and led initiative to implement training, education, and best practices for healthy prenatal and postnatal development, particularly for communities with the greatest infant mortality and morbidity disparities. Today, I have with me Samara BlauRoby with the African American Babies Coalition, Nedra Robinson with Simpson Housing as a testifiers, and Dominique McQuarrie with Wilder is also available for questions.
Thank you, Representative Richardson. Is Ms. Robinson available?
Yes, I'm here.
Robinson, welcome to the committee. You're first on my list, so I would love to hear your testimony.
Well, my name is Nedra Robinson, and I'm the Early Childhood Program Manager for Simpson Housing Services, and also a founding member and trainer for the African American Babies Coalition. So I've seen it work since its inception. It's well known that trauma, stress, and systemic racism have adverse effects on mothers and children, especially our African American and Native American women. But we also know that when people know better, they do better. And that's often the mantra that you will hear within the African American Babies Coalition. The work of the coalition is important because it comes from a grassroots effort of African American women to support, mentor, and coach other African American women about maternal health, parenting practices, and overall child health. We train within our community for our community. Because of my work with the Simpson Housing Services, I see on a daily basis what poverty and inequities in healthcare does to young Black mothers. Education through culturally relevant training with nurturing and compassionate trainers is one of our best defenses. A quick example of the powerful work of the African American Baby Coalition is the collaboration between the coalition and Simpson Housing. We held a Mother's Day of Healing for our mothers in our supportive housing program. This was a special all-day retreat for these parents that included speakers highlighting the importance of prenatal and maternal health and building resilience. Small group sessions encouraged creativity and healing. Through our community-based trainings, African American mothers learn about supporting babies' brain development, strategies that they will use to overcome stress and improve their health, and how to self-advocate in the healthcare process. It's exciting for me as a trainer and as I've done trainings to actually see through our discussions that young Black parents are learning the importance of high quality and consistent prenatal and maternal care. I strongly support House File 1268. Thank you.
Thank you, Ms. Robinson. And I'm new at this, so I'm going to ask you to say your full name and your title for the record.
Okay, thank you. Nedra, Nedra Robinson, Robinson, and I'm the Early Childhood Program Manager for Simpson Housing Services.
Thank you, Mrs. Robinson. And Representative Richardson, you have one more testifier, I see.
That is correct.
And may I call, oh boy, this name's going to be a...
Chair, Samara BlauRoby.
Thank you, Representative Richardson. Are you available?
I certainly am.
And I'm going to do this right this time. Can you say your record? Can you say your name and your title for the record? Thank you.
Thank you. My name is Samara BlauRoby. I am the director of Wilder African American Babies Coalition and Projects.
Thank you, and you can continue with your testimony. Thank you.
Thank you. Good afternoon, and thank you for this opportunity to testify. My name again is Samara BlauRoby. I'm the director of the Wilder African American Babies Coalition and Projects and program manager for the Integrated Care High Risk Pregnancy Initiative. I'm also, on a personal note, a grandmother of 19. Wilder AABC works to meet the needs of all our families. Our interest and my passion presented today is the continuation of our work with focused on teens, prenatal health, and training healthcare workers. Through our programming, we address adverse childhood experiences by training the workforce in culturally relevant care through evidence-based training designed from experts in the healthy development. This creates new pathways of health for the entire family. Our concentration, especially right now, is on the human factors related to health and personal interactions with emerging health issues and stress related to COVID-19. My focal point today is on the Black and Indigenous and communities of color with an evidence-based fact. The stress of poverty has the profound indication of disrupted brain development in infants and mental inhibition in adults who are worrying about their finances and the lack of spending crucial time with their families. There lies the problem of social determinants of health, unsafe environments for teens, women, and babies. Fathers living with depression, worrying about their families, often leading to mental health disturbances for all of the above. In passing Bill 1268, we will be able to expand and deepen our work at AABC. We believe we can benefit as a community by paving the way for all families by acknowledging their circumstances and letting them know they're not alone. This allows us to recognize some triggers which bring out inappropriate behaviors, letting them overcome barriers and learn the everyday essentials of care for a vibrant social life. In closing, I call on you to help pass this bill so that our women, babies, and parents can flourish, providing the attention needed to build healthy human beings. Thank you.
Thank you, Director. And I want to thank both the testifiers today. This is such an important subject, and it's great to see that they have such strong advocates as both you two. Are there any questions from committee members? Representative Morrison.
Thank you, Mr. Chair, and thank you, Representative Richardson, for bringing this bill forward. I appreciate Ms. Robinson and Ms. BlauRoby, your testimony. Given that we have really a crisis of maternal and infant mortality in Minnesota, I'm glad to see this bill go forward. I'm sorry it's a one-time appropriation, but I think that reflects the urgency of our need to address this issue. So I'm grateful for the ideas, and I'm grateful for the bill, and I urge support from everyone on the committee. Thanks.
Thank you, Representative Morrison. Are there any other questions from committee members? As not seeing any, it looks like as the chair, I'll renew my motion that 1268 be put for possibility inclusion on the finance bill. Thank you, Representative Richardson.
Thank you, Chair.
Thank you.
Thank you.